The Health Ministry has ordered all central institutions, including AIIMS Nagpur, to install oil and sugar boards, vivid posters spelling out how much hidden fat and sugar lurk in everyday snacks. It's a first step towards treating junk food like tobacco. My colleague Karthike with more details.
I think it's the right move because the Prime Minister had spoken about the oil consumption and said that India needs to reduce the oil consumption. It has jumped from 8.25 kg per capita to 23.5 kg per capita from 2000 to 2025. Do you think that this is going to resolve the issue?
I definitely welcome this move. And why is it important is because I personally believe after the pandemic, our bodies they are not the same. There is a permanent inflammation which has come into each and everybody's bodies, which we see in clinically in the raised ESR, in the raised C-reactive proteins, which is becoming very common. We also see that people are getting fatty liver far more than they were getting. Initially, the fatty livers were more alcoholic predominant, but today the fatty liver is because of inflammation. And what is this cause of inflammation? It's the kind of food which we are having. Now, if you really see the jalebis and the samosas, they are being made with reused oil. That means the oil is used once for frying and then again it is used for frying. So all these creates carcinogens. This creates compounds which damage the liver, cause inflammation. So if you look at the rising number of diabetics in our country, if you look at the speed at which cancer is rising in the country, it's all connected to food, environment. Okay. So food is something which is in our hands. So I welcome the move that the government is taking a keen interest in it, in its public welfare. And definitely we need to have some control systems if we really want to keep our people healthy.
Okay. Let me take opening comments from Dr. Parjeet Kaur. Madam, do you think it's the move in the right direction?
Yes, definitely. I believe this is a very important, vital step taken by the Health Ministry. Much needed, much awaited step, because I think people are already aware that these foods are unhealthy. But unless it comes out from the Health Ministry, unless this is taken up by the whole community together, this is not going to change. So coming by the Health Ministry, all community involved in this for making this change will make a big difference. And definitely we know that these food items are connected to the rising obesity, rising diabetes, cardiovascular diseases and liver problems ahead. So I definitely welcome this move.
Okay. And Dr. Ananya Avasthi, founder and director, Anuvad Solutions, joined me. Your opening comments, madam.
So I feel that I definitely welcome the move by the Ministry of Health and Family Welfare, that at least today I have received so many calls from my friends and family who are finally recognizing that yes, your samosa and your jalebi is unhealthy. And so there are questions, leading to, okay, what are junk foods? What all,
but Dr. Avasthi, life का क्या होगा अगर जिंदगी जलेबी और समोसे से रूठ जाएगी?
Correct. So moderation is the key. आज जितनी बारिश हुई है Delhi में, I was also thinking that, let's have that one samosa today. But the fact of the matter is that people don't really know. I would beg to differ that, and especially in rural areas, it's not even an urban phenomenon. Some of the research that we are doing in UP, you find that children are addicted to biscuits. Children are addicted to even packaged foods like chips and samosas and kachoris without quite realizing how harmful this is for diabetes, fatty liver, hypertension. So the point of the matter is that nothing is banned really, because diet diversity is the rule of nature, but people should be able to make informed choices. You should at least know that your samosa or that kachori, which has been fried in the same oil 10 times in a day, contains high amount of carcinogens. That can be a game changer.
Dr. Shikha Sharma, is it because of the fact that अगर मैं मीट नहीं खा रहा हूँ, अगर मैं एग्स नहीं खा रहा हूँ, अगर मैं फ्राइड पूरी खा रहा हूँ, people think it's still better than the meat? Is it because of that we in India has not developed that appreciation of a sort of a better protein-rich diet? It's more carbohydrate-centric, and these are supposed to be easy food. So you don't see them the way they bring calories, one. And secondly, you also don't know how many times that oil has been used.
Absolutely. If you really see, most of these vendors and many of the street vendors are reusing the oil multiple times, which becomes very, very toxic for the body. It's not that somebody's going to eat that samosa and drop dead, but the chemicals which are going inside, the harmful things that slowly and insidiously damaging the body. And personally, I don't call it food. this is recreation. This is recreational food. Nutrition is something which does good to your body. Like if you're having apple, if you're having a fruit chart, I would say it is food which is doing good to your body. It's the food, actually the food is what your body is made of. If somebody asks me what is the raw material or by which your body is made, it is food. So I call this recreational food, like alcohol, like other things. So we have to put a difference between recreational food and nutritional food. So I think that yes, people drink, people have alcohol, people have so many other smoking, and they say, oh, we smoke once in a while. What's the harm? It's not going to kill us overnight. But once we understand that the difference between recreational food and nutritional food,
or madam, is it, Dr. Kaur, I want to hear, is it because of the fact that in our country, motapa and obesity is not considered a disease? Charbi chad gayi, daud lo to charbi utar jayegi. Without, and people are not to be blamed, no, everyone is not a doctor interested in wellness. Without understanding that that might affect your pancreas, your kidney, there is something called inflammation. The way they may affect your stomach lining, your gut, which is supposed to be your second heart, and then it can cause irreparable damage because ultimately your body will have no insulin equilibrium, and then it's all down south.
Right, right. I totally agree with you. I think this is the concept which you're saying, that people think obesity is not a disease, has to be changed. In fact, the term has also changed for this. It's come out to be like adiposity-based chronic disease. So obesity is definitely a chronic disease, and people have to realize that once they're obese, they need to take care of their health to prevent them from getting diabetes, cardiovascular diseases. And the way to obesity is all the lifestyle. It's a diet, exercise, and I think this step which has been taken by Health Ministry will definitely at least give them some awareness. See, mindset takes long time to change, but we have to start and can be inculcated gradually. So being aware of these food items that are not healthy, maybe at least make them cut down their frequency of eating them, if not totally altogether out. Cutting the frequency of eating these items will also help them in a long way.
Absolutely, but Dr. Awasthi, it's sugar and oil which is creating the complication. Both were not available in large quantity 100 years ago. And specifically, if you would have seen in that Hotstar, the Brown Heart, the documentary, it complicates the situation more for us because genetically we are more predisposed towards having heart diseases earlier than the Europeans. So, how, what is your advice? How should sugar, fat and oil be reduced in our diets?
Right. So I'm a public health researcher, so I'll give some idea of the science behind it. When we say junk foods, we essentially mean HFSS foods, foods high in fat, salt, and sugar, right? So and FSSAI has been working towards limiting the consumption of HFSS foods, and these junk foods come in two categories. One is, sort of unregulated market where you're getting your samosa, vada pav by small vendors across the markets. The second is all these packaged chips and cold drinks and even burgers that you get at big multinational, FMCG run restaurants. The question is, as a child, we have grown up aspiring to have that burger, say at an internationally acclaimed chain. When we are growing up, our favorite actors were talking about Thanda Matlab. And similarly, you would have the cricket team endorsing soft drinks. Now, what has happened is all the junk foods, whether it's packaged or whether it is not packaged, like the advisory that we see today that the Ministry of Health has come out with. What has happened is it is linked with a certain aspiration of good food, of rich food, of luxurious food, whereas in fact our own traditional diets, right? Pehle, when we were growing up, so Dadi Nani used to eat those moti roti, ya bajre ki roti, right? And now with the, I guess something has to do with the Indian cuisine also.
Dr. Awasthi, I understand. I think I understand what you said. Ghar ka khana khaya karo, and I think that's the most beautiful thing, which is there in our society. But the products have actually invaded even our kitchens, in a very insidious way. For example, the way dalda came into the Indian household life, saying that it's the thing, but ultimately, we all have to talk about ghee and mustard now. Or for example, madam, the way chips and